Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning and welcome to Ethical Perspectives on the News. My name is Diehl. I currently am the Vice President of the Interreligious Council of Linn County and the President of the Humanists of Linn County. On this morning's show, we're going to talk about vaping. Should we be concerned? Now, some of you may not be familiar with what vaping is, but I have three distinguished guests with me this morning that'll help us kind of work through this issue that's been, it's been in the news a lot lately. I think each one of you has been active in some way addressing this. And I'd like, before we get started, to just briefly have you introduce yourself with your name and what you do and why this particular subject, vaping, is important to you.
My name is Julie Woessner. I am the National Policy Director for CASAA, which is the Consumer Advocates for Smoke-Free Alternatives Association. And I also serve on the Board of Directors. And we represent those who choose to use low-risk alternatives or may choose to use them in the future, low-risk alternatives to smoking.
Thank you.
Good morning. My name is Pramod Dwivedi and I'm Health Director of Linn County Public Health. And our mission is really to protect and promote healthy behaviors and health of the residents of this county. And I appreciate your invitation to talk about this very emerging public health issue in our country and our state and our localities.
Thank you, Pramod.
My name is Emily Parker. I am a prevention specialist at ASAC, also known as Area Substance Abuse Council. Work in the prevention department, so we work with a lot of schools and other community organizations to kind of educate about different drug trends and substance use disorders that are impacting our community and raise that awareness. Vaping has been a huge issue that we have seen, and a lot of schools have reached out to us about this concern and the health implication it has specifically on youth.
Yes, and Emily, as we talked about earlier, you were actually in a Iowa high school here recently giving a public talk on this, and we want to talk about that because that was really important, and I think it'd be interesting to share that with our viewers. But I wanted to kind of start with, what do we mean when we say vaping, right? Because again, many of our viewers may not be familiar with that term, but they're, I think, oftentimes used interchangeably with e-cigarettes, even now juuling, and so on and so forth. So the state of Iowa actually defines an e-cigarette as vapor product means any non-combustible product which may or may not contain nicotine that employs a heating element, a power source, an electronic circuit, or other electronic, chemical, or mechanical means, regardless of shape or size, that can be used to produce a vapor from a solution or other substances. So again, as we'll talk about, this isn't just nicotine, it isn't just a harmful drug or anything like that. Sometimes it's just could be a juice of some sort. Including an electronic cigarette, electronic cigar, electronic cigarillo, electronic pipe, or similar product or device, and any cartridge or other container of a solution or other substance which may or may not contain nicotine, so they're emphasizing that is intended to be used with or in an electronic cigarette, so on and so forth. So that's how the state of Iowa defines it. Certainly it's something that's an emerging technology, right? I think lawmakers and just people in general are trying to wrap their head around what is this? Are there concerns? Are there dangers? And Julie, I want to talk a little bit about, because your organization, as we talked about earlier, maybe just talk a little bit about what you do, because I think you have a unique perspective on this, and I'd like you to maybe just share a little bit of that with us.
Sure. So my organization, CASAA, was formed in 2009, which is quite some time ago, and we represent consumers. We're not an industry group, and our whole reason for being is to provide truthful and accurate information so that people can make informed choices, which we think is very important, and then also to fight to make sure that adult consumers have choices, that the low-risk alternatives are affordable and accessible and, frankly, enjoyable. Because that's what makes them effective. Nobody likes to use something that doesn't taste good or is unpleasant. So we found that our membership currently is a little bit better than 250,000 people. And the vast majority of those are people who use e-cigarettes. And the vast majority of those people are people who are former smokers.
Right. So your organization, and you said, I think earlier, more than 90% of them actually do use some sort of vaping product, right?
Oh yeah, it's probably like 98%.
98% out of 250,000. So they're finding success, I would think,
Yes.
from using this device as opposed to traditional cigarettes or something
That is correct. And they have dramatically reduced their risk by making the switch to vapor products.
And what are these people telling you? I mean, why are they vaping? Is it just because it's they need? I mean, there's got to be a point at which they've stopped smoking and they're now just doing it as recreationally, or how does?
Yeah, I think, you know, I hate to cast the whole discussion in terms of smoking cessation, but the reality is the vast majority of adult vapors are people who are former smokers, and they're using it to not smoke. They've just kind of replaced their smoking habit with something that is dramatically less harmful. But you know, why do people smoke? I mean, there's an enjoyment factor, there is a relaxation, there is, you know, nicotine has some beneficial aspects. I mean, we talk about all the negative things about dependence and addiction, but you know, there are some positives associated with nicotine use. And so, you know, people find that using vapor products helps them to not smoke. I haven't smoked in more than 10 years.
Yeah.
And it's because of e-cigarettes.
Interesting. Now, Pramod, I'd be interested in your thoughts on this. I mean, as the Linn County Public Health Director, do you see success with people using these vaping products as a way to kind of wean themselves off of traditional cigarettes, cigars, nicotine products?
So that's how it has been projected in our day-to-day conversation, that this is a less harmful way to quit smoking. But you know, we are talking about maybe it may be helpful for some people who have chronically been smoking, but we have to look at a lot of folks who are young, adolescent, because vaping, as you saw, Centers for Disease Control and Prevention's recent report, that it has dramatically, by 78%, the rate among high school students has gone up. So which is dramatic, and I think the industries that are making vaping devices are adopting the same strategy, dangerous strategies to really. I'm talking about the strategies that smoking industry in the past has adopted, you know, in terms of making it very, as you said, very, you know, relaxing and.
But it is.
It
Now,
could be, but
Right.
it's a dangerously addictive, and it's really a threat to public health. And we have to. I mean, thank God that we have very robust public health infrastructure. ASAC is part of that. So we are trying to educate and make people aware of the dangers. We are most concerned about our youth or adolescents. I mean, we are looking at data earlier on that, you know, there were about 32% ever used vaping devices, and 25% currently in the prevalence rate is 25% in Iowa. And it's going up. That's the main concern for all public health professionals.
So you said it was, it's extremely addictive. Now I'm assuming you're referring to the nicotine.
Nicotine.
That's within the vaping.
And
vapor
I
itself.
respectfully disagree with you that, you know, we talk about negative elements of nicotine, but there is nothing positive about it. I mean, it's a
I'm
really.
going to disagree with you on that.
I mean, you know, for developing brain, it's a synapses. I mean, synapses connectivity is damaged. It's harmful for pregnant mothers.
Are young people especially prone to this, or are you just talking about the population in general when it comes to brain development?
the developing brain among adults and until mid-20s.
Okay.
There's actually,
Mid-20s. There's a
No,
very,
go.
evidence behind this, science behind it.
well, there's actually been research that's shown that nicotine that's been introduced into a developing brain makes them more susceptible to substance use disorders later on in life.
Yeah.
So that's, you know, marijuana, that's opioids, that's alcohol and things like that.
I'd be interested in that research, because most
I
of what I see is rodent
I got
studies.
it.
Yeah.
There are
And mice are not
nicotine,
humans.
I mean, vaping, I mean, you could have any dangerous component inside your vaping device. You know, we don't know. A lot of people
Yeah,
don't
it's
even
not-
know what is in there. You know, it could be dangerous to your health.
You're saying it may not just be nicotine, it could
Yeah,
be other.
could
and
be
it's different.
any number of things.
Now, Julie, you said you disagreed with the fact that nicotine didn't have any positive qualities about
Yeah,
it.
it does.
What-
I mean, we can argue whether the positives outweigh the negatives or whether the negatives outweigh the positives. But, you know, for example, you know, we see cognitive improvement. You know, there's research and discussions about its role in terms of Parkinson's. You know, there are some benefits associated with it. There are some downsides when we talk about dependence. But when you separate nicotine from the really harmful delivery, which is smoking. I mean, I think we'll all disagree on some issues, but we will all agree that smoking is by far the most dangerous way that one can use tobacco. It's the most dangerous way to get nicotine. It's lighting something on fire and then inhaling the products of combustion.
Yeah, because there's not a link, correct me if I'm wrong, between vaping and lung cancer or any other cancer. Is that right or wrong?
Well, I mean, the science is inconclusive because there's
Okay.
not enough data to make that connection. But nicotine, we have researched it to the fullest, and we know its consequences. You know,
But it's not a carcinogen, right?
correct.
You
It's
have-
not carcinogen.
So, I mean, I want to be really clear, the things that cause cancer with smoking, it's not the nicotine.
But there's
So-
chemicals like formaldehyde and benzene and those things. There are carcinogenic chemicals that are in these electronic smoking devices.
But what happens is a lot of those studies have been when researchers have misused the products. So for example, if you were using a vapor product and you put it in a smoking machine doesn't know when to stop, right? It'll just keep smoking, and it'll heat the product to the point where the liquid burns, and it's an acrid, just horribly unpleasant taste, and it's not something that a human would willingly do. Like, a human's not going to run a device that hot because it would just taste disgusting. So certainly, though, when the products are heated, you know, overheated to the point where you're talking about combustion, there are some potential problems. I would agree with you, but we're not seeing that in terms of actual use of the products. That's more of a misuse.
Well, I mean, there is a very clear-cut research on the consequences of nicotine, right?
What are some of those
what would
consequences?
they-
That's what I'd be interested in.
So
hearing.
it can harm the parts of the brain that control attention, learning, mood, and impulse control. And it's also a gateway to other substance abuse, such as you said, marijuana, or other substances that can be. I mean, there's a literature, there's a research behind it. It's not.
Yeah, but you know, not all research is created equal. I would suggest that there are going to be some children who are going to engage in risky behaviors. And if they engage in one risky behavior, they're likely to engage in another risky behavior. And I think that
So
part of what we should
what's
be
our
doing
role
is,
as a society?
I
What's our
will
role
tell
as a
you,
society?
No,
I think we need to get to the root
Yeah,
causes as
yeah.
to why children
Yeah.
are
Yeah.
doing this risky behavior. And
Yeah.
you know,
One thing we did talk about earlier was we were talking about like 78% or whatever the number is of 11th graders that admit to using some some vaping product. I think within the last month. I think was
That
the
was
actual-
78% increase.
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 Thank you.
Previous year.
But the number of 11th graders that reported smoking, like a cigarette or a tobacco-based product in the last month or something, it was like 1 to 2%. So it does seem
Very low in
Yeah,
Iowa.
it does seem that it is very low historically speaking. Is that
That's a
correct to
victory
say?
of public health.
Yeah,
That's really public health intervention. And I'm just very, very concerned that the industry, the vaping industry, is adopting the same kind of strategies to portray its product that it's as though it's a safe, but it's not safe.
Well, here-
wait.
Go ahead.
Can I say something?
It could be okay for an adult who has chronic addiction
Okay,
to
yeah.
nicotine to move him away from this addiction by using
Well, I want to talk about the
electronic
marketing,
devices.
though. I think that there's a feeling that there's a lot of irresponsible marketing or whatever, but I can assure you that the federal government actually prohibits vapor companies
Now it does, but
no, it's-
before then, before 3 years ago,
But
I mean,
if you would
your
allow me
industry
to
was
finish.
was
It's
actually
not my industry. I'm a consumer.
Okay, so the industry was actually selling all kinds of what do you call
Different e-juices,
Di-
if you looked at their marketing
flavors,
as,
different flavors that would be attractive to young.
Well, just so we're
young
clear,
people.
I'm going to admit to being over 50 years old, and my absolute favorite is peach, with a quick follow-up by bubblegum. I actually like bubblegum.
Right.
I have to find it.
We're
It's hard to
talking about the
find.
vaping
The
juice.
vaping,
Right,
the
yeah.
vaping flavor. Adults do like flavors, but I take your point on the marketing, but I would like to make the observation that the federal government prohibits, number one, from manufacturers, retailers are not allowed to talk about these as smoking cessation devices. They can't say, come on in and quit smoking with these. They're prohibited by law. They're also prohibited from making any claims
No,
that
that's
No.
not necessarily true, because
it
if you
is.
listen
See
to the radio ads, I hear it all the time, advertising Juul products, helping to quit smoking.
they
I
don't
saw
say
it
that.
as,
They say
and-
make the switch.
which is exactly
they
what
don't
that
say,
means.
Yeah.
But they don't say make the switch so you can reduce your health risks. The other thing that they're prohibited from marketing on is making what we call modified risk claims. And that's any kind of claim that suggests in any way, shape, or fashion that these products are less harmful than another tobacco product. So they can't talk about the fact that these are dramatically less harmful. And
They
so
are
all their
harmful,
kind of,
less or more. I mean, they are harmful, right?
if you talk about in the absolute sense, everything we do is potentially harmful.
No.
Walking across the street is
Yeah,
harmful,
okay.
but we
Yeah, but that's
use
a necessity
crosswalks.
versus an option.
Right.
You have to walk across the
I
street.
think
you
of it-
don't have
I
to
think
use
of it
There's
as
some
a-
truth to that,
yes.
but we don't have to ride a bicycle.
Sure. No,
But
I
we
think of
choose
it
to.
as a cost benefit, analysis, right? I mean, in some sense, that's what we do have to do with everything, right? Alcohol, I mean, you name it. Riding our bikes taking our car to work, right? There's an inherent risk with that, cost, if you will, and we have to again weigh that against what kind of benefit is that bringing to society. And I think at which point is we agree that the cost outweighs the benefit, then we develop policy and so on and so forth around it. But I did want to bring up here something from the spokesman for Juul, which is the company that
right.
promotes these or produces these vaping devices, right? And they said in a recent article I found online, they quote as saying, "Our mission is to improve the lives of the world's 1 billion adult smokers, 34 million of whom are in the United States, by eliminating cigarettes. Our success as a company ultimately depends on getting our product into the hands of these adult smokers and keeping it out of the hands of youth." So I'm wondering, I mean, that's something they publicly put out there. I can only assume that that's part of their
Marketing and messaging,
intent to do
yeah.
that.
But you have-
But in one way, is there a way for these companies that are selling a product that people demand, for what, right or
Yeah.
wrong, people demand it, right? They may enjoy it, they may be addicted to it, who knows, right? But ultimately they're buying it, and internationally it's exploding. How can local governments, state governments, the federal government maybe partner with these organizations to help address maybe the youth vaping? And I do want to now, after we talk about this, get to your event that you had at the local high school.
So I'm just going to first answer that first portion of the question. I don't think it's really a question of collaborating. I think it's more of an effort to educate and to do intervention options. Electronic smoking devices are already here. I mean, that's the reality of the situation, but it is impacting our youth. So what are we, going to do to lessen that? If you look at surveys done with youth, they say these products are a lot more accessible than combustible tobacco, like cigarettes. They say, it's something that their friends are doing and things of that nature. So we need to change that model. So what are we going to do to change that model? And some of that, like you said, is me doing a parent night at a local high school. So I worked with a school, their faculty reached out to me and asked me to do some education related to vaping and other different paraphernalia and drug trends that we're seeing. And, parents are very concerned. It's not just this high school, it's multiple high schools and multiple counties that we're working with. It is a problem and it has increased significantly. They really don't know how to, address that situation. What kind of intervention models do we have? When somebody's smoking a cigarette. You can smell it on them after they leave, but it's very easy to hide. They can go into the bathroom. Kids have been known to even blow it into their shirt. It does not smell bad. And their friends are doing it, and specifically related to the Juul, it looks like a USB. So it's easy to hide and, parents won't necessarily know. It's not like it's that hard to purchase. It's find somebody who's 18 or, even go online to buy these kinds of things. A lot of these age restrictions are clicking yes or no, are you 18? Or yes or no, are you 21? Oh, okay, that looks good. You can purchase it and we'll get it shipped to your house. So I think parents don't really understand how it is. I've had, parents approach me, well, I bought my kid one, it's just water vapor, right? And it's not a vapor. So I have a little issue with it being called vaping because it's an aerosol, like what comes out of a Febreze can. It has secondhand smoke correlated with it. It has third-hand smoke correlated with it.
No, not actually, because there's no smoke. Smoke requires combustion.
No, she's talking about aerosol.
So
it's not
third-hand
vapor.
aerosol, third-hand smoke.
Yeah.
But I mean, that's the generalized term for those things, which are not only impacting the person who is using it, but the people that are around them.
See, now that's an interesting part that I wasn't clear on because, certainly with secondhand smoke, I remember, 15 years ago we were having the same argument about, secondhand smoke. Is it bad? Is it not? What are the health risks? I think the consensus now is yes, secondhand smoke. There's a health risk. Now, I think, are you saying that there are, if I breathe in the aerosol or the vapor, however you want to call it, that there is a health risk to me as the secondary consumer?
Yeah, it goes right into your lungs. I mean,
Okay,
deeper
so I'm going to disagree.
Okay,
Right.
yeah,
So,
let's see what he has to say.
we don't know what kind of products we are vaping, right? And often it has been found that those products are not good to your health, and the alveoli, that's where they go, and they can. But again, it's a new phenomenon, and we don't know the real consequence of those aerosol that
So
we are
there's
breathing
not
in.
good studies that really
Not at the moment.
But you have to think about this. It took, a 25 to 50 year study to find out what is so wrong with combustible tobacco like cigarettes or smokeless tobacco. So we're already finding health implications from these devices. So what are we going to find in 25 years, and is it going to be too late? Because nicotine is addictive. It's just as addictive as heroin.
No.
And people don't realize that.
People ruin their lives with heroin, and I think that it really kind of denigrates the really serious health consequences and social consequences associated with heroin
I think she's
addiction.
just talking about the addictiveness, not the damage itself, but
So-
how hooked on you can become is as bad as if you had heroin. That kind of nicotine addictiveness is that kind of serious.
We don't
have
see
to
that
save our
among
kids,
our people.
from this. Adults, they can use it as a cessation device, whatever, but we must protect our youth, which are who are so vulnerable, and they are being engulfed by these industries so that they have adopted this, behavior, risky behavior. I mean, can you imagine in last 2 years, the rate of vaping has gone up twice? That's really a huge, massive public health concern for all of us, and it should be. And I would invite you to, be an advocate so that our youth can be saved from this onslaught.
And your organization doesn't obviously promote youth using this device, right? I mean, you guys
look,
are on,
I'm a mom. I can give you a list of all the things that children should not be doing,
Right.
and it's a long list. So, no, we don't advocate youth use, but, we also think that we need to have honest conversations, and we really encourage parents to get involved and to not kind of push this off. They should have conversations with their children. If they find that a child's been vaping, they should talk with their child. They should say, so I'm curious. How often are you using this? Why are you using it? If the kid says, I'm using it, I don't know, I get like anxious and it calms me down. Well, maybe that's an indication that we ought to explore some of those negative feelings. I mean, there's something that drives youth trying risky behaviors. I'm not trying to minimize it.
Well, if you look at evidence-based research, which is the entire platform of prevention work, they look at kids' use by their perception of harm and accessibility. So when we have these devices readily accessible and on the counter, which was the thing for the longest time until fairly recently, it's right there. And then since it's grown in popularity, especially amongst their peers, that perception of harm goes down. So they don't think, oh, this is bad for me, this is not as bad as cigarettes, or this is not as bad as this.
But that's the truth. I mean, we might sit here and say they shouldn't be using
But if
any
that's
of this,
impacted
right?
their perception of how bad it is, and it's grown that much in popularity, that's an issue.
and we just had a couple.
And in as little as middle school age children, there's 5% that smoked, or not smoked, that vaped in the last 30 days.
Yeah, but that's that's
Not ever.
right. Okay,
past 30
the last
days.
30 days.
Yeah.
Half the time they don't even know what they're using.
Yeah.
We're finding that kids are reporting
So that's-
they don't
that's-
even know whether they're using it.
That's
half the
alarming
time.
thing. That's
But
alarming.
But that
I
almost
agree,
just-
this is a cause for concern. I don't want to minimize it, but I want to put some perspective here and put it in some context, because this is yet another risky behavior that youth are engaged in. I don't think that we're spending enough time as a society trying to get to the root cause. Instead, we just keep treating these behaviors instead of what's driving it.
Yeah, and I think, right, and I agree that you should have, we just have 1 minute left, but I agree there should be a holistic approach to it, right? We're not going to just stop doing this, right, and expect the kids to fall in line, right? You got to be a parent, you got to spend time with them, you got to invest in their lives, all this stuff that we know is helpful to promote positive behaviors. And there's but yeah, I mean, I think generally the idea here is that the evidence isn't super clear right now. I think your two position is that, because we're not sure, let's kind of be cautious, let's kind of play it safe. And I think you're just saying, let's make sure we balance out the conversation, right?
Yeah.
Let's not be too alarmist here, and let's just be reasonable. And I think all of that is good and healthy. So again, thank you all for joining us, and thank you viewers for joining us this morning. I hope you have a great Sunday, and I hope this episode has been helpful to you. Take care now. Bye.